the recession drags on, many people in San Diego are working hard. Many others are desperately looking for work and still falling behind.
We are releasing a study today about what it really costs to live in this region and the many people who are truly struggling to meet absolutely basic needs.
This news conference is about the number 3 in 10. 3 in 10 households in San Diego County cannot afford to live here.
Our problem today is a shrinking middle class, in which we have fewer and fewer middle-income jobs with career ladders.
Nobody wants to be out of work, on welfare, or unable to take care of their families. In difficult times like these, we need to preserve and strengthen our county's social service safety net. Those county services are essential to families who are struggling. With these critical services in place, people stand a chance of being able to get back on their feet.
CalWorks is a program that helps financially with food, medical. They provide help with childcare, transportation. I started vocational school to be a medical assistant like about a year ago. I'm almost done. I got 10 more days.
County employees help the community on so many different levels. Some are out there and the community sees them on a day-to-day basis, but most they don't see. We're all here to make sure that the community functions in the best way possible.
County workers are often the last line of defense between a family and heartbreak. In this economy, they are helping people from all walks of life.
Since the recession, we see people that they thought that will never be in line at the family resource centers, and the old name was the welfare department. Now we see people that had good jobs, people that are professionals, but because they lost their jobs, they lost their health insurance. When I started working back in 1989, we only had like 360 cases. I retired from the county in 2007, and at that time I had like 600 cases.
One essential and underappreciated service is in-home care that allows people with disabilities and chronic disease to live at home instead of in an institution. San Diego County has more than 22,000 in-home caregivers. Most of them are paid only $9.50 an hour, which means they're struggling to get by themselves.
I work as a in-home support service provider. I work $9.50 per hour.
My job is a provider for in-home support services here for the county, and a member of the United Domestic Workers of America, the union which represents the providers here in San Diego County. If these programs are cut, our recipients, our clients, are going to have to be placed in institutions, which in effect will cost the taxpayers much more money than it's costing now to have this program.
Whenever possible, caregivers are family members of the client.
That's the main thing, to have love, compassion, and an understanding, which you don't in a rest home.
Basically, it's 24 hours every day, and there's no breaks. To add more to the difficulty of it is the pay. I'm behind on a lot of bills right now, but like I said, it is rewarding.
Our working families are facing multiple crises in this region: housing, fuel, food, childcare, and health insurance. CPI has informed the dialogue between workers, employers, and policymakers so that they can take this information and tools to the halls of power where decisions are made that impact our working families. County workers are on the front line giving care to those in our region that are the most neediest.
And the workers who deliver those services deserve not only our respect, but they deserve our gratitude. Please join CPI in fighting for a stronger middle class by securing at least a living wage for every worker.
We have to join together and create a San Diego that not only creates jobs, but creates good jobs.